This is a short video on the UDS Depression Screening mid-2017 update. So what has changed? The screening is now required for depression rather than clinical depression. And depression can include situational issues. For example, if you have a patient whose mother passed away, that would be an example of situational issues. For the follow-up action, if the patient has a positive PHQ-2 or PHQ-9 or score of 1 or greater, a follow-up plan needs to be documented in the progress note. Possible follow-up actions include, but are not limited to, review and or reevaluate the depression score at a future visit. The patient makes a follow-up appointment to monitor depression. A referral can be made for counseling or pharmacological intervention. What is an appropriate treatment or action? This chart shows PHQ-9 scores and proposed treatment actions. For example, a patient that has a score 0 to 4 may not need any further action. Patient with a score 5 to 9, the level of severity is mild, so this might just be watchful waiting, repeating the PHQ-9 at a follow-up visit. The treatment action is per provider's discretion. This chart is only provided as a reference. The UDS report will look for an intervention flag in the progress note that tells them something was done. If the patient has a score of 1 or higher on the depression screen, it will look for the following flag in the HPI section. This intervention flag tells the report that the provider is aware of the depression screen and the appropriate treatment or action has been taken. This is like marking a lab as reviewed. The provider is aware of the results. Sometimes a follow-up is needed, and sometimes it's not. Changes to ECW physical and annual template. These templates require doing the PHQ-2 as part of the exam. The template will now automatically pull in the required intervention flag. So if I pull in my template using my arrow, my 2 templates will appear in the HPI. Notice the intervention flag at the bottom. That's been completed for me. Changes to the ECW template continued. So for the well-child check template, 10 to 20 years, currently has a built-in modified PHQ-9 depression screen. Our UDS report is having issues reading and pulling data from this section of the progress note. So we're going to have to make a slight change. The modified PHQ-9, 12 to 18 years old, name will change to depression screening. Instead of having the PHQ questions listed in the progress note, it will require you to do the PHQ-9 SMART form that has been tagged. Just click to open. The answers in the score from the SMART form will populate into the progress note. We have also reformatted the supplemental questions and suicide screening section. They should be easier to complete with less clicks. The template will also pull in the intervention flag. In the CDSS tab, there is a yearly reminder for the PHQ depression screen. Clicking on the arrow will cause the PHQ-2 SMART form to open. If the patient has a score of 1 or higher, the PHQ-9 SMART form will also appear. If the total score is 1 or higher, an intervention flag must be present in the progress note. However, this flag has to be added separately. There is a way around that. There are now 2 PHQ templates available for use. Instead of clicking the plus sign in the CDSS alert and adding the intervention flag separately, the template will drop the needed flag. If you have a score of 1 or higher, the flag is already present. So when you pull in your template, this information will appear in your HPI with the needed intervention flag. And that concludes our video. Please let us know if you have any questions. Thanks for listening.